We talked about gummy smiles, gum recession and what you're doing, cosmetic dental implants for the teeth that are missing in the front of the mouth. Tell me about that.
Yes, cosmetic dental implants are a big part of our procedure, and this is what is something of a passion of mine, because it not only do we see a lot of patients who need this procedure because they're missing teeth in the front part of the mouth. People may have lost their teeth due to accidents, for example. We see a lot of young individuals who have had accidents. Some patients have had accidents as a 10, 12-year-old, and then 10 years later, 20 years later, their teeth all of a sudden start failing. And so we see a lot of this problem, but it takes a lot of experience and a lot of...
But can you match them up, though? The dental implant? Isn't that the problem with dental implants?
Yes,
matching them up?
Yes, and that is where a lot of experience and expertise comes in, Randy. And that's where my passion comes in teaching and in treating these type of patients. Because one of my biggest passions is teaching other dentists to do this correctly, because we see a lot of second opinions if these cases have not been done correctly.
So what could go wrong, briefly, and then we'll talk about what could go right, because you have some photos.
Yes.
But a front tooth, it's showing, what could go wrong with inexperience?
Well, with inexperience, just to simplify, what can go wrong is that not only can the implant basically fail and get infected, that's the most drastic thing that can go wrong. But what can go wrong, what is most drastic for the patient, is that it doesn't look normal. It doesn't appear natural. Somebody looking at you can tell you that's a fake tooth. That is not your own tooth. And that is the most bad thing that can go wrong.
I feel like I could spot people that have something. I don't know what it is, but it's definitely not a real tooth.
For example, look at this this case here. This case here, this is an example of a case that was referred to us because this patient had an implant placed by another dentist.
So that right top tooth, to my eye, is an implant.
Exactly, because it's off. It's asymmetrical. It doesn't match the adjacent tooth. And because this case was done without any planning, it's like you're building a house. You would never build a house without a blueprint. So it's the same thing. Why would you have surgery, especially in an area that's visible, without having a blueprint of how to do it? So in this case, you can see it just catches the eye. So we went in and did a reparative procedure.
So a general dentist sends you this case?
Yes.
They say, you know what, we need Dr. Boltchi for this case.
Well, yes. This case, yes. This case was done by another practitioner who had placed an implant. The patient had gotten the crown and obviously paid for it and everything.
So the patient wasn't happy?
No, but the patient wasn't happy because this was appearing unnatural. Everybody in her circle of friends and family was noticing that this is unnatural. And after we repaired it and we fixed the situation, this has been now about 6, 7 years out, and it's still stable.
Yeah, it's very nice.
Yeah, there's no way a person at social distance would be able to tell that this is an unnatural tooth.
No.
And so this is at the lower end of the spectrum, the procedures that we do in the cosmetic zone.
But does it cost more? Like if you want cosmetic dental implants, does it cost more to go to a specialist, a periodontist?
No, and that's the interesting part. Not necessarily. It doesn't necessarily cost more to go to a specialist. The only thing is that the specialist, like I am, we do these procedures all the time. That means I don't...
Like every week you're doing gum stuff?
Yeah, I don't do any fillings. I don't do any braces. I don't do any crowns. All my focus is only on these procedures. And so ultimately, obviously, especially with my teaching background, we focus on these things and we are more trained in them. But no, our fees are not any higher than any other person doing it.